you so much for being here today. Diana is a marriage and family therapist. She is our counselor, providing mental health services and emotional support to many families. She is trained in suicidal and crisis intervention, career counseling, cultural diversity, behavioral issues such as depression and domestic violence, family conflict, among others. So we appreciate that Diana is with us today, and she has a lot of great information and knowledge that she will be sharing during this time. Um, she has been helping many families in crisis, and we hope that all her expertise and experience help us this afternoon. Self-harm may also be called self-injury, self-mutilation, or self-abuse. All of these terms are applied to behaviors, and it can be conflicting and confusing at times. So could you please tell us a little bit more about self-harm, what it means, and to share about some of these behaviors?
Yes, thank you so much, Yvonne, and thank you so much, Dr. Leocares, for having me here today. Self-harm, I think what you just mentioned right now is very accurate, but self-harm behavior, it's a behavior that is done deliberately on purpose to harm oneself. And it's really a way to cope with emotions. I'm not saying that the person cannot deal with the emotions, but the emotions are that big for that person that the person will then go to self-cutting or self-harming as a way to cope through and work through that emotion. In a nutshell, that's what it is. We do see it very commonly in adolescents. That's probably where we hear about it the most, but it does happen in younger children and also in adults. So it's not exclusively, and I think today we are going to be very general, so that way we can cover all the age groups that we may have here today. So like Yvonne mentioned earlier, and Dr. Leocares mentioned earlier, if you have questions to a specific age group, please feel free to put it on the chat so we can address that specific age group. But self-harm is something that affects multiple age groups. It's just that it's a bigger emphasis in adolescents.
Mm-hmm. Diana, can you also tell us a little bit about what are those forms that self-injury takes?
Yes, so I think one of the most common forms of self-harm is cutting. That's probably something that we hear pretty often, especially amongst adolescents, but that's not the only form of self-harm. You can also use hitting yourself or bruising yourself. You can do hanging, you can do like suffocation or scratching of the body, even taking too much medication to the point of possibly overdosing, overeating, or maybe drinking too much to the point that is poisonous. Those are also considered forms of self-harm.
And when we're talking about drinking, we're thinking about alcohol. Although you could also, there have been studies where you can drink too much water and that can actually be harmful as well. And other forms to also consider, for some people, even such things as piercing, so ear piercing or piercing around their body, even tattoos when it goes beyond what could be considered normal. And again, normal is a very, there's not one definition for normal. That could also be a form of self-harm as well. So there's, again, different, it's not just a one thing. So it's not just a cutting that can be self-harm. There's a lot of ways to self-harm as well. Even isolating, I know, Paige, that you mentioned isolation, especially in teens. And although we are going to be talking about all age groups, but definitely in teens, even self-isolation could be considered a form of self-harm as well. So again, when certain behaviors are not being done in moderation, they could be considered self-harm. um, up to and including self-care. If we say that we're doing something for self-care purposes, those could also, if we're doing it more than what is considered healthy, that can also turn into a self-harming behavior.
Yes, I'm glad, Dr. Decares, that you mentioned isolation, because you see two things here with self-harm. You see the isolation piece that could be self-harming, and then you see in the case, I want to say it was Paige who mentioned that her daughter isolates, and if she is already doing some other type of self-harm, her isolation could be a result of the other, of which if she's cutting, her isolation may be due to the self-cutting. So there's those two pieces that I think are important to touch on today as well.
We have a question in the chat from Nelda Rivera. Says, are there warning signs we might spot on time for proactive action?
Yes, there are. You'll start to see, I'm not sure, did you mention a specific age group?
No.
Okay, so
No.
yes, you'll start to see isolation as one of them. You'll start to see that if you see that the person's having a lot of difficulty with working through their emotions, you'll start to see those behaviors, and in each case may look different, but you'll start to see maybe the person's no longer wearing, short sleeve shirts. They now are starting to wear long sleeve shirts, or they're starting to cover, I should say, areas where they either have attempted to cut or have cut. That's where you start to see some, just very, very briefly. The thing with self-harm is that it's usually kept very much under wraps. So it's not something that is talked about. So unless you're very close to this person and you can really be aware of behaviors that are changing, maybe they're not as interested in the things that they used to be interested before, or there's a major change, in how they are acting, you may not see the self-harming behaviors until after the fact. Because
I
this
think
is
another thing, yeah, go ahead.
Go ahead, Dr. D, sorry.
No, it's okay. I think another thing to also take into consideration is if it's a loved one, and from what I'm seeing in the chat for most of our participants, it usually is a loved one. What in the field of counseling we consider baseline behavior, right? So baseline behavior is basically what we would say is their normal behavior, how they normally act. If you see a change or a variation in what their normal behavior, normal routine, normal day looks like, not saying that it's a cause for concern, but maybe it's a reason why you are on tonight's discussion, because you're seeing a change in this person's behaviors. But another thing to also take into consideration is, for instance, we're still in a pandemic. Has people's behaviors changed? 1,000%. Everyone's behaviors have changed, right? Including the professionals. So just because there's a change in behavior, that is not the only sign or symptom to look for. It's usually a combination of things. And when we're diagnosing, when they go see a professional, there has to be a list of criteria that the individual meets in order for them to get the diagnosis, right? And so because you're the loved one, if you're seeing more than one sign or symptom, there could be something going on. And probably one of the best things to do is provide a safe space to have this conversation, which even us that we have been trained and we have gone through a lot of training, it's still a difficult conversation to have, right? Because who wants to talk about self-harming behaviors? It's a tough subject to talk about, right? And so again, I would caution you that if you feel that a loved one is self-harming, take into consideration their environment, take into consideration if there has been any life changes or world changes or just any types of changes outside of their behaviors as well.
I think that's a great point, Dr. Delcares, because I think that takes us to other factors, right? There's the environment factor, there's the individual factors, there's, just a family factors, and maybe even social factors, right? And if we're looking at some individual factors, we're looking at things like anxiety, depression, maybe low self-esteem or a sense of hopelessness, things of that nature, right? Very individual to that person. When we're looking at family factors, we can be looking at, parental relationships, maybe drug and alcohol use or misuse in the family, unreasonable expectations, right? Maybe there is a history of mental health difficulties in the family already. And then we also, and that's just a few of the things, right? If we go into social factors, right, difficulties in peer relationships, peer rejection, abuse, availability of the methods of self-harm, things like that, friends who may also self-harm, right, as a coping mechanism, and now they have shared this information with their friends. And, I think with teenagers, it's that media in the internet influences.
Absolutely. Social media is huge. The most recent one that I've heard about, and I do not go on social media, in fact, I try and stay away from it, is the AirPod one. There probably has been a more recent one, but when teens were eating AirPods as part of a challenge, that is definitely a cause for concern for mental health professionals, because that is a huge way of self-harming. We talk about cutting, but again, there's different ways to do it, of, hitting their heads. Again, a lot to consider when we're doing violent behaviors that are usually considered self-harming behaviors. So again, just keep that in mind. We do have a question in the chat. My brother is very open about his cutting and wears short sleeves and doesn't hide it. Do you think that is more for attention in his case? That's actually one of the points that we were going to be talking about, and I'll let Diana respond and then I'll just follow up with what she's saying.
One of the things that, Dr. D and I have talked about is that when we're talking about self-harming behaviors, they can either be looked at as attention-seeking, really far left or really far right, when we're looking at, possibly, suicidal concerns, right? And typically what we see is that they are not attention-seeking behaviors. They're ways of coping with emotions. That doesn't mean, though, that it could not be attention-seeking. It could be attention-seeking behavior. And I think one of the points that we also talked about is that some people enjoy pain. I know it's taboo and it's not something that we may necessarily want to hear, especially as if we have loved ones that are self-harming, we don't want to hear that this is something that they enjoy. But that is a very much a reality out there. So I'm not sure if in his case is him wanting to gain that attention or that concern from family, from friends, or does he enjoy this? Does he find this soothing for him in a way that he enjoys?
Well, and another thing that I think and not when I say we, I'm talking about mental health professionals, but just as a society, when we think about attention seeking, it's usually seen as something negative, right? When in reality, it's really not necessarily something negative. If someone is seeking attention, it could be a way to communicate that they want help, that they need support, that they are asking for somebody to reach out and make that connection with them. And so necessarily, if someone is doing it for attention seeking reasons, it doesn't have to be perceived as something negative. So again, just to keep that in mind. And then following up with what you said, Diana, and we'll probably have another podcast about this as well, but if we're looking at BDSM in sexual play, some people, I mean, BDSM, that's what it's about, right? It's about experiencing pain. And I feel like there's a very thin line between pleasure and pain. Some people even use BDSM play to work through some trauma, and that's a very controversial sentence to say. There's still a lot of research that's being done about it, but there is research to support that because, and again, if you're engaging in healthy BDSM play, because you are now in a controlled environment, whether you're the one that's doing it or it's being done to you, there has been a level of understanding, healthy boundaries, negotiation, conversation, safe words, everything that goes into BDSM play so that you are able to work through trauma in a healthy environment. Is it possible to re-traumatize? Absolutely, if it's not being done correctly. Again, that's going to be another podcast if you guys are interested in it. But what we're talking about tonight is mostly about mental health concerns, not necessarily just BDSM play. So absolutely. Could your brother be doing it for attention seeking? Yes. You know, it might be his way of saying, you know what, I do it. I'm okay talking about it because it seems like he's pretty open about it, like you mentioned. So maybe he's inviting conversations about it as well. And it doesn't necessarily mean it's a negative thing. It could just be his way of providing support for other people that don't feel comfortable talking about it.
Right.
And we understand that every case is different, and this is a very generalized conversation. But again, in a generalized form, would you please tell us a little bit of the treatment for self-injury?
Dr. D, do you want to touch a little bit on that and then I follow up after you?
Yeah, there's also some questions in the chat that I don't want to ignore. So after we're done answering this question, we'll look at the chat as well. Are there types of treatments? Yes, but before we get to treatment, I think that we should talk about what can you do as someone who is living with or has witnessed self-harming behaviors, right? One of the things that, and Diana and I, we've talked about this as well, and please interrupt or contribute as I'm talking about it. But one of the things that we definitely want to encourage people to do is provide a safe space and time to talk about this topic. And by that, I mean, it's, again, like I mentioned earlier, it's a very scary topic to think about, and it's very easy to make it about you, right? Because it's such a scary topic, you can, you know, you might get anxiety, you might start to panic because you don't know how to deal with it. You may also feel like you don't have the right words to be able to talk to this person, but remember, they are a loved one. They know you and you know them, and you know the ways to support them. And so just being able to provide a judgment-free zone and just be able to listen. A lot of times we want to fix, right? And someone who's in pain doesn't necessarily want you to fix their world. They just want you to listen, and probably be able to just talk about what it is that they're feeling in ways that maybe you may not understand, but that doesn't mean that it takes away from your capacity, ability, or want to be able to listen and understand.
Yes, I agree with you, Dr. D. It is important that anytime that we're going into wanting to talk about self-harm, that we're going in with the intent to understand how that person is feeling, what that person is going through at that time, because it can be very easy to not realize that we're putting our own feelings into it. Looking at yourself and maybe even understanding what self-harm, you know, means to you, and even looking at some of the things like how does that make me feel that someone else is, engaging in self-harming behaviors? Looking at your own feelings is going to be very important when you are wanting to support someone who's engaging in self-harming behaviors. And I would say that if you're having difficulty with understanding your own feelings, that you do talk to a professional that can guide you through that, because then that professional can help you maneuver through some of the feelings that maybe it's your own stuff that is coming up through all of these things, maybe are things you experience. And in that way, you are providing the best support that you possibly can to that person, because now you're highly aware of your own feelings and emotions before you're going into the situation. And really, the role of the person who is supporting someone who's engaging in self-harming behaviors is not to find the solutions to those problems, right? It's truly to understand. Like Dr. D said, it's not, they don't want advice. They're not wanting you to fix the problem, but I think it's human nature to go in and want to fix it. We want to fix it. We want to make it better. We want to, make sure that they are happy that they're not doing these things, right? But we need to take a step back and not go in with that, which is, it's hard to do. It's really hard to do, especially if you're a parent, it can be very difficult to do. It's difficult in general, but it's looking at yourself first. And this is where I would say, if some of those feelings are too much or you can't make sense of them, it would be very beneficial to seek professional help.
And then if we are looking at treatment, and again, usually this is done in a higher level of care, which could be either inpatient or outpatient. It's usually done through counseling, therapy, some form of, sometimes even medication is necessary. But there's a root to why this is happening, right? Whether it's because of trauma that has now created triggers, that has now caused this person to get triggered, and therefore they are engaging in these behaviors. So again, there's a lot more that obviously we're not going to be able to touch on tonight because it's a very extensive topic. There's a lot to talk about, and we are just talking about in general terms right now. We're not getting into specifics, because that would mean having a conversation with that person and possibly with the family as well, to find out, what is causing these behaviors. And it could just be, like Diana mentioned, a variety of issues.
Now that we're here and most of us are concerned about our loved ones, would you please give us some tips on how to cope, some coping mechanisms for that person is doing the self-injury and their caregiver?
Yes, there are several things that, the caregiver can do to help them maneuver through the self-harm. One of the things that Dr. Diocares mentioned earlier is creating a safe space for the person. That's very important. Telling them that you care about them and being genuine about that, regardless of whether they are self-harming or not. Being as available as you possibly can for them, but also being realistic with that, right? Be honest about what you can and cannot do. Don't commit to more or less. Commit to what you can do, and be honest about it. If the person is open, right, for professional help, then the opportunity to have, that conversation. These are all like things that you can talk to with the person who's self-harming about. One of the things that was that we, I think, talked about the other day was, should we start removing things from the house? Like, should we start removing objects from the house, the sharp objects and things like that? Sure. you can start doing some of those things if it is something that you are able to do, right? If it's sharp objects or pills or things of that nature, you can do it. There may be some circumstances though when you may not be able to remove those items, but if that is a possibility and if that is something you're able to do, that is also something that can help. Just keep in mind that self-harming, if the person is is using it as a coping mechanism, they're going to look for these items. They're going to find these items. Now we're talking, right, if you maybe have an adolescent or a child, maybe those things won't be easily accessible anymore. But if we're talking about an adult or someone, an older teenager, then they're going to at some point find access to some of these things or to something to be able to soothe that. So before you take things away from the home, my suggestion would be that you come up with another plan. You do have to build that trust with the person. It's so important to build that rapport with the person, for the person to be able to trust that they can come to you and that there is no judgment, in that they can come and let you know, hey, like, I really want to just cut myself right now. Okay, then let's come up with what things that we can do. There's breathing techniques that can be done, right? Let's go out for a walk. But have this conversation beforehand, if of course, if you're able to, so that together you have now formed a plan. The person has a way to communicate to you that, hey, right now I want to self-harm. Okay, now we're in action and we're going to go for a walk. Let's go work out. Do you want to talk about it? Do you want to tell me what's happening, so that we can figure out your triggers and figure out how to put coping mechanisms towards those triggers? So it's really a partnership, right? But that partnership won't happen unless there's trust. There needs to be, I can't emphasize that enough. I think it was Paige that was mentioning, that trust with, even with a therapist is crucial. It is crucial for the other person to be able to share what is going on and what they're having difficulty processing. So those are just some of the things. There's a full list of things, but one of the things that you definitely don't want to do is, if we're talking about a younger, underage children, you don't want to punish them for the self-harming. You do not want to, you don't want to provide a punishment after you found out that they've self-harmed. That does not help them. That actually may make them feel more alone. And it may be disappointing for you that no matter what happened, the person cut again. But again, it's where we go back to saying you have to work through those feelings, right? Because it's not going to be easy for this person to stop something that they are probably used to doing. So those are just some of the things that you as a person, can do. Self-care is important. Go for that walk, go read that book, disengage for a little bit. Some of those hobbies and those things that you do, you may need to put them into effect whenever you're starting to feel that burnout, when you're caring for someone who self-harms.
And it's very easy to burn out. It's very easy, especially if these behaviors seem to happen quite frequently. As the caregiver, as the family member that is a witness to these behaviors, you can definitely burn out. And it's super important for you to be able to set your own healthy boundaries. And part of that is doing it through self-care. One of the things that, if you signed up before Monday, I sent out a self-care kind of kit for you to work on. And tomorrow, when we send out a copy of the recording, I'll send it out again. But we definitely encourage you to engage in your own self-care. And if you'd like to know more information about self-care, we actually do have other master classes about it as well. But we'll be talking about self-care some more, but definitely important for you to take care of you, because if you can't take care of you, you're not going to be able to take care of anybody else, or you're not going to be able to do it as effectively as if you had been caring for yourself as well. in one of the comments that I'm seeing in the chat, there's various forms of self-harm, and I'll just go through the list. There's skin cutting, which is about 70 to 90% of self-harming behaviors. There's head banging or hitting, which is about 21 to 44%. And then there's burning, which is about 15 to 35%. There's scratching and drawing blood, punching self or objects, infecting oneself on purpose, inserting objects in body openings, drinking something harmful, breaking bones on purpose, misusing alcohol or drugs, deliberately starving themselves or binge eating, excessively exercising. That is definitely a form of self-harm, which could be kind of seen as, oh, well, you're exercising, right? So it's something healthy. Again, if we're doing it excessively, it could be considered self-harm. Engaging in risky behaviors on purpose, including sexual behaviors. And I did see that in one of the comments, engaging in risky behaviors. So that could include having sex with multiple partners with no protection or birth control. Knowingly having sex with someone who does have an STD or an STI, putting themselves at risk for a myriad of different kind of behaviors, and then pulling out hair. And again, this is just a small list of what self-harming behaviors can look like. But definitely, again, because you are the loved one who is seeing a change in behaviors, or maybe these are ongoing behaviors that you're seeing, because I did see in one of the chats that maybe this is something that they have been doing for quite some time. And we definitely would recommend, if this is something new or if there's a change in behaviors that you're just noticing, we recommend that you reach out to a mental health professional, whether it's us or whether it's, there's a lot of free resources as well. We'll also be providing a list of resources tomorrow in the email that I'll send you. But again, there are local, national resources that you can reach out to help you with this, because sometimes, and we have to be honest, sometimes you may not have the emotional capability or the emotional resources to be able to have those conversations. As much as you want to have those conversations, just sometimes it's too much. And that's okay for you to realize and understand that maybe, you know what, I'm not the best person to have this conversation, because I will lose it, or I will panic, or I will not know what to say. And that is okay. And that's why it's important to reach out to the professionals, to people that are able, trained, and willing to help you have those conversations, to give you the resources, to give you the support that you need. Because let's be honest, as family members who have a loved one that does this, we also need support, right? We also need techniques and coping mechanisms for sure. So definitely reach out for those, because they are available for you.
Yes, then Dr. Adi, to add to that, I read something on the chat about multiple people self-harming in this family, and it does get tiring, and it is very draining. One of the things is to understand is to go back to the factors of what may be causing that self-harming behavior, because as much as maybe I may want to support and help a person, if their environment or those individual factors or those social factors haven't changed, it is going to be very difficult to break that that self-harming cycle. And so sometimes we as people may take that responsibility to say, oh, it is my job to make sure I fix it or make sure I support them in any way, is where we need to take that step back and see what type of environment is that person in that is causing these behaviors. If they're open about it, then maybe you already know. If they're not open about it, maybe it's something that needs, that it's important to seek understanding of. And again, getting that support for you, right? Not being afraid of taking that break and setting that boundary.
Correct. And everybody in crisis deserves support, and respecting your own needs and limits is a critical part of supporting someone else. So it's
Yes.
important to listen to your own needs and see where you are and if you're the right person to be supporting at that time. So I think I'm not sure if there are any more questions in the chat that we want to address at this time, or we want to open for anyone else that wanted to ask a question at this moment.
I think another thing to also talk about is that for the most part, there is a lot of guilt and shame attached to these types of behaviors. Mostly because, again, like Diana mentioned earlier, it is a taboo way of it being a coping skill. It is, for the most part, not acceptable as a coping skill. And Diana, you talked a little bit about, that spectrum of self-harming to suicide. And I think that most of us hesitate to talk about, was that self-harming with the intention for suicide? And at least in the training that I have received, what ends up happening is people start to self-cut as a coping mechanism. And it's kind of like a drug, right? You need more of it in order to get the same result, what it is that you need, right? Whether it's the self-soothing, whether it's that high, whether it's feeling something. And so what ends up happening many times when suicide does happen is that people go overboard. So because you need to cut deeper, because you need to strangle yourself longer, because you need to go further than you have before in the behavior, that's usually when it can lead to a suicide. So again, if it's somebody that has been doing it for quite some time, that could be one of the reasons why it seems like it's becoming more excessive. And I don't know if we have, other than, I believe Paige mentioned that she did engage in self-cutting behaviors, but I don't know if any of our participants have engaged in self-harming behaviors themselves. But again, the more that you need it, the more that you need to do it with more intention so that you are getting that same, what you're seeking out of it, right? Again, whether it's self-soothing, whether it's coping, whether it's whatever the reason that you're doing it for.
Right, I'm on the same page with you, Dr. D. There was a question here. So changes in behavior can be alerting signs like less social interaction or social avoidance. If it is an extreme change, yes, it could be an alerting sign either for possibly depression, maybe anxiety, and would have to keep an eye on that self-harming behavior possibility. But yes, if this is someone who was socially interacting or was very much of a social person and all of a sudden that's not happening, then I would ask those important questions like, what's going on? Is there anything you'd like to talk about? And
With
say
the
those things.
understanding though that we all became somewhat hermits when the pandemic happened. So
Correct.
please keep that in mind as well. Most of us had to stay home, right? And so we had to self-isolate, which is very different from if you were doing it before or you're doing it more excessively now. So again, we have to whole picture, not just certain symptoms or aspects, right?
Right. And I can give an example, right? You look at somebody who's very introverted, then the pandemic was probably the best thing that happened to that person, right? Because now they don't have to engage in social interaction, in social settings. Someone who is highly extroverted probably had a difficult time having to stay home, or they probably found other ways to socialize with other people. So what you're saying is absolutely right. You need to look at the whole picture. There was something about my daughter used to talk to herself through her bouts of self-harming. Is that a way to punish herself for things she can't share or own up to? I'm not sure if the talking was the talk. if the talking was about maybe an emotion, then it could be her expressing what's happening at the same time that she's cutting. But I don't know, Dr. D, if you have maybe more of an insight on that.
Could you give us some more information? Is it Nilda? Could you give us some more information when you say talking herself through it? Was it negative self-talk?
She would be mumbling to herself
Okay.
behind the closed door to her room. And sometimes it would seem like she was arguing with herself. So sometimes when I heard her, I asked, "What you talking to?" And she say, "Nobody." And then I knew something bad was going on because she would be so adamant about it, but still I could hear her. She would
What
use
was she
some skin
arguing?
glue. She would use some skin glue to try to hide the marks.
Some skin glue?
Yeah, the kind you use when you have like a bruiser or a
Right.
little opening in the flesh. But that's what she would
Okay.
use.
Okay, and you mentioned arguing. So was it, did it sound like she was talking down to herself? Does it sound like she was insulting herself or calling herself names? What was it that you were actually able to hear?
No, sometimes she was mumbling to herself and I could just hear her murmuring, but sometimes she was outright like she was having an argument with somebody else, but there was nobody else in the room. And when I asked her, she said, "I'm talking to myself," or "I'm not talking to nobody." So what were you talking about? No, nothing. It was to myself.
How old was your daughter at that age?
15.
When of this 15?
15. Today, to this day, she's 29 already. I cannot vouch for her not cutting herself anymore, but she is definitely getting way too many tattoos and piercings. She is using alcohol and smoking pot, getting into risky social behavior, getting into very dysfunctional relationships. And sometimes she would come over because I was taking care of her kids during the day before I broke my ankle. And then she'd say, "You know what, my psychiatrist said I might be bipolar, or he said I might be autistic, or he said he wants me committed." But then she would never go with any of those alternatives. She would stop going to that psychiatrist. She would not commit herself to a psychiatric hospital, and she would not agree on getting tested for any specific diagnosis. So it's very hard to help her.
Absolutely. Absolutely. And I think you brought up a really good point, right? We just touched very lightly on it could be anxiety or depression, but obviously, once the person goes to see a mental health professional, a further diagnosis can be done because again, there has to be, there's more than one symptom, right? And so the fact that if she was diagnosed as bipolar behavior, and again, this could be another podcast, but bipolar behavior, usually the cutting behaviors or the excessive behaviors happen during a manic episode as opposed to a depressive episode. Autism is a completely different thing. There has been cases where people have been misdiagnosed as well. And obviously, we're not going to get into that conversation, but it sounds like there's a lot that was happening there. And the fact that she doesn't feel comfortable or isn't at a point where she, of her own free will, is going to get help. Sometimes it's the intervention of family members that force her to get help. And if we're looking at extremes, family members are able to request that the person gets help. Sometimes even the mental health court, and I don't know if you guys were aware, at least in the United States, there is a mental health court which forces treatment on the person. And most of the time, if not all the time, it's a combination of psychotropic medication, which is medication that they have to take for their symptoms, along with counseling or therapy.
We have several cases in our family, so I think everybody's trying to look out for a way to help them. The other cases may not be the same.
Mhm.
They seem to sort of mimic each other. They're about the same age, and they're all females.
Mm. The other thing to also consider is that some of these behaviors could actually be learned behaviors. And by that, I mean that if we're seeing these same symptoms generation to generation, what's happening is they're being learned by the previous generation, right? So let me give you an example. We all learned how to cope with anger, how to react to anger by our parents and our caregivers, right? Whether healthy or unhealthy behaviors, we learn them through our parents or caregivers. And so, and I'm not saying that these behaviors that you're talking about have been learned, but there is a possibility that they are ways that have been passed down from generation to generation on how to cope with stress, how to cope with anxiety, how to cope with uncomfortable feelings. Does that make sense?
It sort of makes sense, but the thing is that they live away from each other. One is my daughter, another one is my youngest sister, who is 20 years younger than me and lives at another place. And another one is a niece, and another one is a cousin. And they're all about the same age. So they did relate to each other at some point during their teen years. Not since about 15 years that they have not seen each other, and they sort of take off in the same direction. Same kind of behaviors and patterns, very different alternatives from the parents. My sister has been to every psychiatric hospital there is in the country. My niece has never been at one because her mom wouldn't subject to that. My daughter did go at some point in her teen years, not since, but I see them all reaching out for the same thing, a way to maybe act out their feelings against themselves. That's what I'd like to help them with. But so far we have to keep a distance because they can be really toxic on you.
Is there a history of mental health in your family?
Not before them.
Okay.
It was like a cluster, you know, they all started out at the same time. And it was like, okay, what's going on here? So let's keep them separate and let's each one look for a way to help them. But even though we took different alternate routes to help, they keep digging into it deeper ever.
Okay.
I think it, go ahead, Diana.
Sorry, I was there was somewhere that I in part of my research was that, you know, and correct me if I'm not saying this correctly, Dr. D, but self-harming behaviors, it is common on adolescents and mostly females. So they are at a higher risk for self-harming behaviors, which is a lot of what you are mentioning right now in your family. They are females, and that is very common to see these behaviors in females. But I wonder, you know, if there are either some mental health concerns or other concerns that maybe affected them, maybe not all at the same time, but at some point in their lives that this is what it resulted on. But that would be a different conversation.
Absolutely.
Yeah.
Well, and again, the root of it could be a traumatic event. And the thing with trauma, and we will have another podcast about trauma as well, is that trauma actually is carried down through generations up to the third generation. So it doesn't necessarily mean that it happened to the person, but if there is a history of family trauma, it could be carried down to that person. And it could, the gene for trauma, because there is research that backs this up, the gene for trauma could be activated just like there is a gene for alcohol or addiction. It could be activated, it could be triggered by something that is related or even unrelated. There's no specific or exact science to be able to say this was the root cause of it. So there's a lot more that we can talk about. We're almost out of time. We do have a couple of minutes, but we do encourage you, reach out to us. Like I said, I'll be sending an email tomorrow with a copy of this recording, with some resources along with the self-care packets. And you can definitely reply and schedule a 15-minute consultation with us and see if our services can help you. We are taking new clients at this time, so definitely reach out to us. Diana, any last words?
Self-care. I just can't emphasize that enough, for especially because it sounds like in the audience there's a lot of caregivers. Self-care. I can't emphasize that enough. In the resources that you'll be receiving tomorrow, there are tons of resources out there for those that are engaging in self-harming behaviors, but also for those that are caregivers, or family, friends, or help supporting somebody through this process in their life. But please make use of that self-care plan. If you didn't receive it, I'm not sure if there's a way to get a hold of Restore and
I'll be
get that.
sending it tomorrow.
Okay, perfect. Just because I think it is important that you self-care. It is important that you look inside of your own self and make sure that, you know, what you are putting out there is what you can put out, especially with the population of self-harming, because it is sometimes very hard, you know, to be that person, to be there for them. And you want to do it as healthy as you possibly can, because you are much more effective if your cup is full. It's the best way I can put it. If your cup is full, you're much more effective.
Well, thank you so much, everyone, for joining us. This opportunity, we invite that all of you join our community here on Eventbrite, and also to hopefully join us for the next event on March the 23rd, which is What Happened to You, where we will be discussing in more depth about this important topic and how can we help our loved ones in the process. Thank you, Dr. Mariela, for helping us with your experience and your knowledge. Thank you, all of you, for taking the time to be here. And Diana, of course, thank you so much for making this very special. Thank you. Anyone else? Any more comments before we close? I think it was a very nice session, and I hope that you can all meet us for the next meeting. Thank you for being here. I will hope to see you next time.
Have a good night, everyone.